everyone. We are so delighted that you're carving out time today to join us to learn more about certification in the field of lifestyle medicine. I'm Susan Benegas. I serve as the Chief Executive Officer of ACLM, a role I've been in for more than 11 years now. And it's just such an incredible gift to be part of what all of us who are associated with ACLM believe is an organization that's addressing some of the most important issues of our time. No doubt about it. And so again, we're just delighted that you are here today. Thank you so much for carving out time. We know time is the asset we all have that's in shortest supply, it seems, even though we all have the same amount of it. But lifestyle medicine is, it's definitely regarded as the fastest, if not one of the fastest growing fields in medicine. And so let's dive in. And what is lifestyle medicine? Many of you today probably already know, but lifestyle medicine, it is the medical specialty that uses evidence-based therapeutic lifestyle intervention to treat and even reverse already existing chronic disease. And this was really the unique value proposition of the establishment of the American College of Lifestyle Medicine back in 2004. They saw that there was this unsustainable epidemic of chronic disease, cardiovascular disease, type 2 diabetes, obesity, knowing that these lifestyle-related chronic diseases, evidence showed then, even more so now, that they are treatable, even reversible through lifestyle medicine. And it's the 6 pillars: a whole food, plant-predominant dietary lifestyle, physical activity, restorative sleep, stress management, the avoidance of risky substances, and powerful positive social connection, connectedness. And it's these 6 lifestyle behaviors in which patients will adopt or engage in that can protect their health, fight disease, even reverse disease. And so the American College of Lifestyle Medicine, next slide, please, as I said, was established in 2004. And so now in its 21st year, we're seeing extraordinary growth. Nearly 14,000 members from every state across the country, and many countries around the world as well. And we really focus on these areas that you see here. We see that one of our most pressing responsibilities is to fill the gaping void of lifestyle medicine, which includes using food as medicine in medical education, doing so across the medical education continuum, from undergraduate to graduate medical education to continuing medical education. And so we focus on these both in CME and academia, things like our culinary medicine curriculum that's been downloaded over 10,000 times from ACLM's website, our growing membership and an abundance of member benefits, member interest groups, over 30 in which members participate, task forces, and many other tools and resources, both clinical practice and patient-facing, that are made available to our members. We have our annual conference, which this year will be coming up in November at the Gaylord Texan. Always a sellout, and if you haven't registered yet, we encourage you to do so. Practice advancement and advocacy definitely go hand in hand, and this is where so much of our focus is now, to really identify and break down the barriers so that you and those who are already certified in lifestyle medicine or practicing lifestyle medicine can do so in a sustainable, scalable way. And of course, certification, which we're here to talk about today. Next slide, please. And our Lifestyle Medicine and Food is Medicine Essentials course, we made a major commitment in support of the White House Conference on Hunger, Nutrition, and Health. And this commitment continues, and it is offering free registration to what otherwise would be a $220 course, 5.5 CME accredited hours in our Lifestyle Medicine and Food is Medicine Essentials course. 1 hour intro to lifestyle medicine, along with our nutrition for prevention and longevity, and nutrition for treatment and risk reduction. And these 5.5 hours that are free of charge, it's a wonderful way for yourself or for your colleagues to really get that first dipping the toe in the water about lifestyle medicine and what it means to you, to your clinical practice, and to your patients. You can scan this QR code or go to lifestylemedicine.org/WH conference and take advantage of this. The availability of it free of charge is through the middle of September. And next slide, please. Blue Zone Certified. It was last year that we signed a major partnership agreement with Blue Zones. And Blue Zones, many of you may know, really it was the identification by Dan Buettner over 20 years ago of identifying the populations around the world that had the longest longevity and the lowest incidence of chronic disease. And really focused on creating an environment, creating a culture in which the healthy choice is the easy choice. And ACLM represents lifestyle medicine trained clinicians who are best equipped to join with what Blue Zones represents and truly manifest this vision of a nation wherein, which is ACLM's vision statement, that we have a nation and world wherein lifestyle medicine is the foundation of health and all healthcare. And at the same time, Blue Zone's vision of a world filled with Blue Zones. Well, it's really the integration of both of those, really the full integration of community with clinical that can manifest and catapult this vision forward. So this opportunity is a new course that will be launching in August of this year, a Blue Zones course in which all who are first a lifestyle medicine certified physician or lifestyle medicine certified healthcare professional through either the American Board of Lifestyle Medicine or the International Board of Lifestyle Medicine that certifies MDs and DOs, or the non-MDs and DOs who are eligible for certification through the American College of Lifestyle Medicine. So any who have first earned that designation will be able to complete this course and earn the added recognition of Blue Zone certified physician and Blue Zone certified healthcare professional. And we're very excited about this partnership and this very needed full integration of community and clinical. And that is what the combination, even though the real heavy lift and the proficiency is demonstrated through the primary lifestyle medicine certification, this additional 6-hour Blue Zones course will add that additional piece of really understanding community, advocacy, and some of those additional pieces that will be of benefit to you and to your patients. And so when we think about the American Board of Lifestyle Medicine, it was established in 2016, hosted its first cohort in 2017. There are now over 8,000 physicians and medical professionals certified worldwide in the field. And so how do we reverse our unsustainable chronic disease trends and their associated costs? Only with lifestyle medicine first approach to healthcare. And how do we achieve the quintuple aim? How do we fully optimize value-based care? How do we reignite the passion in why most went into the field of medicine? All of these only with lifestyle medicine as the foundation of health and all healthcare, and only when lifestyle medicine root cause treatment is the first treatment option. And this is why there is so much explosive growth in the field. And so we really, again, appreciate your time today, your interest in lifestyle medicine, your interest in certification in the field. It is really by filling this gaping void of lifestyle medicine, and as I said, food is medicine and medical education, and equipping you, educating and equipping you and your fellow physicians and medical professionals with information, training, knowledge, skills that you did not receive in your formal medical education. And so with that, next slide, please. We'll be diving in today, and I welcome on this call Rebecca Deutsch, who serves as the certification manager and has for many years for the American Board of Lifestyle Medicine, doing so for maintenance of certification for the International Board of Lifestyle Medicine, which now, again, we have over 30 medical professional associations around the world, and this exam is hosted in many countries around the world. And joining Rebecca today is Dr. Brenda Ray, who is the Medical Director of Education for the American College of Lifestyle Medicine. So I will turn it over now to them.
Thank you so much, Susan. It's been wonderful to be here with all of you guys today and to have you with us, Susan. So I wanted to change the thought process here just for a second and say, why get certified? Why does it really matter? And you may be asking yourself that, or you may have had colleagues that you've had that conversation with. So I just wanted to say that for me, it's been one of the best things that I've ever done. I was part of the initial cohort of examinees that were certified in 2017, and I have never looked back. So I wanted to share with you guys some of the highlights for lifestyle medicine certification that I've heard and have experienced and would love to share with you. So the first one is that this certification really helps demonstrate the desire to practice at the highest level. It shows that you have the competencies and the skills and the knowledge to be able to do this and do this at a very, very high level and expertise. The next thing is that it really provides ongoing validation of your experience, knowledge, and skills. So having this certification really does say to everyone around you that you know what you're doing. And so your colleagues, your supervisors, admin, patients, they're looking for this. So be able to share with them that you have the certification is always really, really helpful. The other thing that's super important is that it prepares you for future job opportunities. There's quite a few people that are really looking for the opportunity to practice in a way that really allows you to align with your patients, have a health coach approach, really help them with their health behavior change. This is the certification that's going to train you to do this. And once you have the training and the certification, your job opportunities will open up. I will just share that there are multiple organizations and health systems now that are looking for trained health professionals, physicians and health professionals in the field of lifestyle medicine to help move their agenda forward to keep their populations healthy. So it's really exciting to have this opportunity. Gives you the competitive edge. If you with lifestyle medicine certification and someone else with in the same specialty without lifestyle medicine certification, you're definitely going to have a competitive edge to be able to show you have an added level of competency that you can share with not only your colleagues, but all those else that are around you and your patients. And the last two bullets are some of my most fun things to talk about. So I can't tell you how many people, when they're learning about lifestyle medicine, going through the certification process, gaining the knowledge, how many of them say, oh my goodness, this is why I got into medicine to begin with. And it's very self-fulfilling. I love getting to work with my patients and actually help them reverse their disease, put their disease into remission, and take them off their medications and deprescribe. It's so fulfilling for a lot of these providers. And then the last one is supports personal growth and well-being. So you'll notice that a lot of you, if you decide to go through certification, will start to actually think about, how do I live my life? How do I want to live it differently? How can I be more balanced? How can I actually live out these lifestyle medicine principles for myself? And we know that providers, clinicians, who actually start to practice these and struggle with them actually address them more appropriately and congruently with their patients as well. So it's really exciting to see. It's not only a shift in your clinical opportunities, your advancement opportunities, your ability to be fulfilled with your patient care, but also to help yourself be healthier and more well. Next slide. All right, so let's talk about the overall certification framework. So first of all, you see on the left side, we have the ABLM and IBLM for physicians, and there's two levels of certification. The first one is the lifestyle medicine physician, which is the foundational certification, and then we have the lifestyle medicine intensivist. The lifestyle medicine intensivist is more of an experience where you actually practice with your patients and you're learning more about the dosing of lifestyle medicine, reversal, putting disease into remission. And there's an experiential pathway and a educational pathway for both of these, for the physician and the intensivist, that we'll talk about in a minute. And then on the right side, we have for non-physicians, or we should say healthcare professionals, lifestyle medicine healthcare professionals. And there's actually certification for them as well, which is super important, that lifestyle medicine is a team sport. And so we all get to work together. And as we have a team that's trained, we're going to be more appropriately able to treat and work with our patients and give them a congruent message as well. Next slide. Okay, so let's just drill down a little bit for the physicians. You can see there's two pathways for physicians, experiential pathway on the left and educational pathway on the right. And I'm going to compare and contrast them for you a little bit. So the experiential pathway is for physicians that have been board certified for at least 2 years practicing in their field of specialty. Whereas the educational pathway, they're actually in a residency program or a fellowship program that has lifestyle medicine integrated into it. And we don't have this 2-year wait period because it's a more robust pathway and they're learning the lifestyle medicine concepts in their educational pathway through residency or fellowship. You can see for the experiential pathway back on the left, there's a 30-hour online course that's CME, and then a 20-hour approved event CME. So our conference is coming up in Dallas in November would meet the criteria for the 20 hours of approved event CME. And this can be done either in person or virtual. So we encourage you guys to think through this. And then you'll notice that the last component for the experiential pathway is a case, and that we have a template. And it's a really simple case, just showing that you or one of your patients has experienced the difference that lifestyle medicine can make in a person's health. So that's the experiential pathway. Let's move over to the educational pathway. So again, this is primary board certification is required. So you become board eligible as soon as you graduate from residency. So you'll be qualified and you can complete the educational pathway in your residency or fellowship training. And the most significant way that people will do this is that ACLM and Loma Linda University have created a lifestyle medicine residency curriculum that can be integrated into any of these training programs. And it includes 100 hours of educational and didactic components, as well as practicum components where you're actually practicing lifestyle medicine with your patients. And so any resident or faculty that are a part of the lifestyle medicine residency curriculum, a site that has adopted this curriculum, can be eligible through this educational pathway, which is really exciting. So what this looks like is you can complete the requirements through the experiential or the educational pathway. And then the exam, it's 150 multiple choice questions. We have it in multiple languages, which is great. Your certification, you're jointly issued by American Board of Lifestyle Medicine and International Board of Lifestyle Medicine. And your nomenclature is you'll be a diplomate of ABLM or a diplomate of IBLM. And you're called a certified lifestyle medicine physician. Next slide. Let's talk about the two pathways for health professionals. So for health professionals, there's also an experiential pathway and then an academic pathway, which means the requirements and a lot of the requirements are integrated into and they get credit for the education they're getting within their academic courses. So the experiential pathway, you can see here, it looks exactly like the physician pathway, except for you're going to be a primary health professional and have a degree that's either a master's or above. So this is a lot of different health professionals we'll share with you in a minute on a new slide. But you can see here the 30 hours of online course CME is exactly the same as physicians. The 20 hours of approved event CME is exactly the same as physicians. The one difference is here the health professionals don't need to turn in a templated case. So that's the exception there. Now, if we move over to the right to the academic pathway, this looks very different than the educational pathway for physicians. We have a partial academic pathway, and what this looks like is you will see that they are in a program, so a primary health professional academic program, either a master's or above. And you can see that they still have the same 30-hour online course CME, but what's different is instead of having to go to an approved event CME for 20 hours, they can actually have an approved academic course within their program, get a B- or above, and get credit for that 20-hour approved event CME to help them move along towards their eligibility for the lifestyle medicine certification exam. We do have a full academic pathway where everything's integrated into the curriculum. We have a few sites that are kind of piloting that right now. And so anybody who's interested, we'll have lots of information for you to know how to get involved and to explore this. So what's different about the exam for health professionals? You can see here that the exam is 120 questions instead of 150. So there's 30 additional questions for physicians that health professionals don't need to take. And this is related to some of the clinical care related to the physicians. You can see here that what's different about the certification is that they are actually certified by ACLM, not ABLM, but they also have joint certification with IBLM. So it's IBLM with ACLM for the health professionals, and it's ABLM and IBLM for the physicians. And then the nomenclature you can see is they're a diplomate of ACLM instead of ABLM, and they're called a certified lifestyle medicine professional. Okay, I wanted to show you here some examples of eligible health professional degrees. We won't go through this in detail, but we wanted to you guys to have a summary of what are the most significant or common health professionals that we usually go through the certification. So again, we have areas of behavioral mental health, rehab sciences, medical and clinical sciences, public health and research. So all sorts of opportunities here for you guys to look at this. And we have the Rebecca here will be able to answer more questions for you if you have it about, she's the certification manager. Okay, I'm going to go ahead and turn it over. The next slide. The last thing here is the certification competency. So if you're taking the exam and you want to know how to study, you'll probably want to take a course. The course that most people take is the Lifestyle Medicine Board Review course, and it does actually meet the eligibility criteria of the 30-hour online CME. And you can see here's the breakdown of the different, there's 10 different modules, and you can see that 26% is nutrition. The next most common is 14% physical activity, and so on. So this helps you understand and know how best to focus your studies when you're thinking about taking the exam. All right, I'm going to turn it over to Rebecca now, and she's going to talk with you about the details of how to actually get certified.
Thank you so much, Brenda, and thank you, Susan, for kicking us off today. And good morning, everyone, or good afternoon, depending on where you're joining us from. We are so grateful you're here to learn more about lifestyle medicine. And my background is exercise science and health promotion, and I am so passionate about this because of the profound impact that exercise has had in my life. And I know firsthand that you can help others improve their life and longevity with lifestyle. So thank you for listening today. Our first recommended step is to become a member of the ACLM. Not only will you get fantastic discounts and access to discounted courses and exams, but it is such a robust community. You would have access to so many other wonderful benefits, like connecting with other members. So that is our first recommended step. And second, enrolling in the board review course. As Brenda mentioned, it is specifically designed for examinees, so we do recommend that. There are other eligible courses that you can find on our website, which we'll touch on later. Next, we recommend registering and attending for Lifestyle Medicine 2025. It's an incredible event every year. We have a wonderful opportunity to connect with like-minded individuals and have delicious whole food plant-based meals together while learning incredible ways to help other people. Next, we recommend registering for the exam. I recommend earlier than later. Our deadline annually is September 30th at 6 p.m. Pacific, and that is a hard deadline. We do not allow any late entries simply for our coordination purposes. They begin immediately after September 30th. And step 5, we recommend downloading the case study template to get started on that. It can be found on our website, www.ablm.org. That is a requirement for physicians only. And lastly, submitting all of your prerequisites before the deadline. We begin our review period 30 days prior to exams. And many people ask whether they can attend Lifestyle Medicine 2025. LM 2025 and still get credit for it? And the answer is absolutely yes. That's an exception to our review period. We ask that you don't need to submit anything in lieu of that CME certificate for the event. You can simply attend and submit it as soon as you earn your certificate. And we do recommend at least 3 to 6 months preparing for the exam, depending on how much time you have individually to dedicate to your studies. And at the bottom here, you can see we accept CME up to 36 months old from the date of your exam. So anything you start this year, we'll accept through 2028. And just a little bit more information about the Foundations of Lifestyle Medicine Board Review course. It's 350 pages, 12 online review lectures, 180 review questions for your convenience. Next slide, please. And we'll be meeting in Grapevine, Texas this year. There's a virtual option available and you can attend virtually for your event CME, and we need you to have at least 20 hours earned. The Lifestyle Medicine Question Bank, while not a requirement for the exam, it would get you 8 hours of CME or CE. And these questions are designed to help you practice for the exam. You won't find content that will be the same necessarily in the exam questions, but the design of these will help you practice and get a feel for what you'll be experiencing in your exam questions. Okay, as I mentioned, the deadline is September 30th every year. And as soon as registrations close, we begin our work coordinating exams. So shortly after that, within the first week of October, you would get your invitation to reserve a seat at Prometric. One question we receive quite frequently is, can I reserve my seat now? And the answer is no. We start that coordination on typically October 1st. As soon as we get a business day after the 30th, that's when you'll start to see your invitations coming out. And you'll be able to select a date and time that's convenient for you between November 22nd and December 7th, and these centers are available around the globe. At any time, if you need assistance during registration, you can email us at info@ablm.org. We have a full-length registration document that would help you step-by-step get registered, but I will say it is quite self-explanatory, but just let us know if you need anything in the process. I won't go over in detail all the pricing, but you can screen capture this if you'd like. ACLM members do get a 10% discount on the certification fee portion of exams. So there is another benefit of becoming an ACLM member. And both Susan and Brenda touched on the incredible growth we've had in Global Diplomates since 2017, which was our inaugural year. We have over 8,000 certified across the globe, and we have over 30 lifestyle medicine societies that are at least initiated and growing rapidly, and we're getting more interest across the globe annually. So I'm grateful you are here to experience that growth with us. In the next slide, we'll see the growth across the US. We have over 5,000 certified here in the US. So we are, the bulk of certification is here in the US, while, as I mentioned, it's growing rapidly otherwise. So we're excited to see that. And let's talk about the maintenance of certification program. After exams each year, so once you sit for your exam, we have results out before December 25th. And then we have our enrollment period between January 1st and March 31st each year. That's when we ask you to submit your payment. And that is the year immediately following your initial certification. So everyone who certifies this year in 2025 will receive their invitation to join the program in 2026. And we ask that the fee is submitted during that 3-month period. And then we ask that you review 3 articles on our platform annually. These are specifically selected articles by our MOC CME committee. We're a global group, and we review several articles and select the ones that we think will be the most applicable for you to help your patients. And then we ask that you submit 30 hours of lifestyle medicine CME CE every 5 years. We do have a list of eligible courses available on our site. And that list is also continuing to grow, which I think is it attests to how many courses we have becoming available and just the general growth of lifestyle medicine. And for physicians and advanced practice providers, we ask that you maintain your primary board certification in order to remain eligible for the MOC program. We collect that after your first 10 years. Without the MOC, your certification is valid for 10 years. And joining the MOC allows for the indefinite opportunity to stay certified. And here again, you could take a screenshot if you'd like, but I think we're ready for Q&A.
Wonderful. Rebecca and Brenda, thank you so much for going through all that. We have a couple of questions I thought we could address for everybody. We had a few questions in the chat about physicians who live in other countries. So Rebecca, could you please clarify the path for international physicians?
Absolutely. It's actually the same. So while you wouldn't need the board certification for 2 or more years, If you are a medical school graduate, you can apply through the same pathway. Our site is just it's just iblm.org rather than ablm.org, but then you enroll and get to the same spot. The prerequisites are the same. And since you can attend virtually, you can attend LM 2025 if you'd like. If you have a lifestyle medicine society where you are located, you can attend your local society, which we absolutely encourage that first. But otherwise, it's still 30 hours of online CE. If you are outside of US and Canada, you do not need to take the CME version of the board review or the course that you select. You can select non-CME and the 20 hours of event CME. And then the registration process is the same. The Prometric Testing Center opportunity is the same, and the time frame is the same.
Great, thank you. And again, another point of clarification that can you talk about LM 25 this year and eligibility and the process for submitting prerequisites?
Sure. So we ask that you don't submit any registration receipts because that tricks our system into thinking that your application is complete when it isn't. You can simply submit your CME certificate as soon as you earn it, and we will review it as soon as we can.
Wonderful. And we have some pretty specific questions in the chat about what degrees are eligible. So could you speak to that a little bit, Beck?
Sure. So
for health professionals.
Absolutely. Can we go back to the slide where we shared some of the degrees, just in case anybody would like to take a picture of that? So it has to be a health-related or allied health-related degree. We have grandfathered a handful of fields here in the US and Canada that once required a bachelor's degree to practice that now required a master's, and those are PT, OT, nurse practitioners, pharmacists, registered dietitians, and I think that covers all of them. But this slide will give you an idea of many of the fields that we will absolutely consider eligible. If you have a specific question about your specific degree, let us know, and you can let me know at the email listed here. Just reach out and I'll get back to you within 24 hours.
And Beck, I was going to just add in here several of the specific questions were about RNs and BSNs and National Board and Health and Wellness coaches. And so I would say, what would you say about those specifically?
Yeah.
So bachelor's degree level nurses are not eligible for certification at this time, but I do still encourage you to email us. I can connect you with ACLM's wonderful director of academic advancement, and she can put you, give you connections for or recommendations for what to do next. So I would suggest still reaching out. We encourage everybody to become educated in lifestyle medicine. So that's what I would say.
Thank you for that. Is there a place that you could point us? We have some questions in the chat about international lifestyle medicine societies. Beck, where would you refer people for that?
So we have a website, the Lifestyle Medicine Global Alliance. It is www.lifestylemedicineglobal.org. And on that site, there is a link to sister organizations, and you can see all that are currently active on that page. And again, if you email us with anything along those lines, we can connect you directly with the society as well.
Wonderful. And then we do have a couple of questions about pass rates. Could you speak a little bit to that, Beck, and expectations around that?
Sure, absolutely. So each year we run a psychometric analysis after exams very rapidly. As soon as the last exam is conducted, we run that analysis. And in the past few years, it's been an approximate rate of answering 55% of questions correctly, with a 90% pass rate based on that figure. So approximately 90% of people will pass the exam. And then the board weighs in on what the pass rate will be based on the psychometric analysis. So it does vary slightly each year, but that is roughly where we've been for the past few years.
Okay, well, I think that, Brenda, did you see anything else in there that you wanted to answer?
I just think that there's still some questions coming in about the sequencing, Beck, and I think maybe let's just say it one more time. So you can register for the exam. Please register by September 30, whether you have the prerequisites actually done yet or not. We understand that there will be people that will be completing their 30-hour online CME or their 20-hour event course after September 30. You can still register for the exam. You can still sit for the exam, but you will not have your exam results released until we have all your prerequisites. Is that what you would say, Rebecca, or is there any clarifications that you would say for that?
I think that covers it, Brenda. Thank you.
Okay.
That's absolutely accurate that your application needs to be complete before you'll receive your exam results.
Well, thank you. Go ahead.
I noticed somebody asked about what about MBBS graduates, and that would qualify you for IBLM certification. Again, the process is the same. You'd be eligible for physician certification through IBLM. It's just a matter of issuing entities.
And there's a couple of questions about, hey, can you tell us if there's a testing site in our region? And so you can just, people can just hop onto the Prometric website and check to see where the Prometric testing sites are and see which one is closest to where you're located. They are all over the world, but there might not be one really close. You might have to travel a little bit to get to it, but you can jump onto the Prometric site to check where those sites are.
Absolutely.
Those were the main questions that I saw come through. We really appreciate everybody who's here. We understand that this is a lot to take in, but we have our website support. You can go back and you can look at this webinar. You'll get a copy of the webinar. We're so grateful that you guys are considering this. If I were to give my last 2 words, I would say if you're even thinking about it, I would say take the deep dive, go for it, make the commitment, and you will never look back.